Hi, everyone, and welcome to the 47th episode of Vitals and Voices. I'm Ladika, and I'm the founder and host.
And I'm Camden, and I'm the co-host, and we serve on an executive team of Vitals and Voices.
Vitals and Voices brings together generations of people involved in healthcare in order to foster a supportive community.
Now, please welcome our guest.
Hi, I'm Dr. Christie Kimball. I am a cosmetic physician in New Orleans, Louisiana. I have a cosmetics clinic, Kimball Cosmetics, and I'm excited to be here. Thanks, y'all.
Of course. Dr. Kimball, thank you so much for being a part of this episode. It means so much to us that you'll be one of our guests today on Vitals and Voices. Kind of feel free to, again, reintroduce yourself and share some things about yourself that you haven't shared as well.
Sure. So I'm 34 years old. I'm actually from Pittsburgh, PA. I came to New Orleans for all of my schooling. So I did my undergrad medical school residency here. I was an internal medicine trained, like in residency, internal medicine trained, but I had always wanted to do dermatology at the time. And I loved the aesthetic world. And so it was a good way to combine my skill sets when I ended up practicing as a hospitalist ultimately for 4 years after my residency. And I loved that. I was good at critical care. That's what I really enjoyed, the procedural stuff and the excitement. But what I always really wanted to do was aesthetics. And so eventually I got to the point where I could combine this and had the guts to go for it. I'm really glad I did. It's been super amazing and I couldn't be happier.
That's amazing to hear. And could you tell us a little bit about what inspired you to go into healthcare?
Sure, yeah. So I think like when I was younger, I always had like a very like strong and driven personality, but I didn't necessarily, I'm not one of those kids that was like, oh, I want to be a doctor right away. And so I think when I got to like high school and I started realizing how much I loved like science and like biology and stuff, and I didn't have any doctors in my family. And so initially I was just drawn to like being, understanding the human body, thought it was so cool. Like kids would be like passing out dissecting the frog in high school, and I would be like, nerdy in it, whatever. And so I just found myself really drawn to it. And then once I got into like medical school, like the studying and everything, I found, you study like you enjoy studying some subjects more than others and just kind of to find your path. So the things I love most about it now is just, making other people feel like confident and good about themselves and being able to use that to go on to do all the things that, that they want to do in their lives because they have the confidence to do so.
I love that. So you originally wanted to go into dermatology, but things didn't go as planned. Can you share what that journey was like and how it kind of shaped you overall?
Yeah, absolutely. At the time, and I actually applied 2 years in a row and didn't get in. And so at the time I was devastated and it seemed so unfair and all the things that, there's a lot of people who can relate to that. I know plenty that my year that had the same thing. It's a very competitive specialty and, there's only so much you can do eventually. But I think that ultimately it forced me to get really out of my comfort zone. I never wanted to necessarily learn to be an internal medicine resident at first. And I kind of saw it as like oh, I'll get through this year and be done with it type thing. And it really, forced me to learn really complex, like amazing, like medicine that could help people because COVID was like the next 2 years. So I ended up being like a big part of the healthcare force for a lot of New Orleans patients in COVID and learning to deal with like being a young woman in an all male environment in the hospital, like as the only female staff when I was first starting, and really just learned to like hold my own and persevere. And the internal medicine part of that actually ended up being the one of the pillars of this business because I started it through the weight loss program, and I wouldn't have been able to do any of that without my medicine background. So I think it ended up the universe always takes you where it's meant to go if you lean into it. And I don't know that I would have loved like the whole lifestyle. What I love is aesthetics and like skin. And I think, the universe sent me to the perfect place to be able to combine all of what I love and my skill sets and be able to help the most people and enjoy what I do the most.
That's so beautiful to hear. And you mentioned working in critical care during COVID. Could you talk a little bit more about that experience and now where it has brought you?
Yeah, absolutely. So I think that I think that what I really realized in COVID was, first of all, like just, I mean, New Orleans had a university in Tulane where I was working had the sickest patients in America. I mean, it was probably one of the top two or three, most critically ill patients. And it's learning critical care can be very intimidating, but it's also like a rush. And it is, if you are a procedural person, like somebody who likes aesthetics like me, you find that you probably, do have a lot of overlap with things you like. So I think that it was a way to really hone in on my critical care skill set. And that was what I ended up enjoying most when I was a hospitalist. So that part of it was invaluable because I could manage a full critical care service by myself without a pulmonary critical care fellowship. And, I could manage my own ventilators. I could manage like things that were very important that I could contribute to humanity. So that part of it was something that I'll always appreciate. And it's one of the reasons that like I feel comfortable still to this day managing like, a lot of the medical things too. My patients will come in. I have a lot of different needs in this practice, and a lot of them are medical. So, and I will say a lot of my patients, I used to be self-conscious about being like an aesthetics provider in this space, having been internal medicine trained, because there's a lot of like shaming of that. And I think it's so cool how almost all of my patients now, the thing that was what made me uncomfortable, like, or, self-conscious, is the thing they love the most, because they say, oh, she's a real doctor. She's going to be able to save us if something goes wrong, like all of that. So I really enjoyed, being able to help people in the COVID stuff, but it was burnout, and it was an invaluable experience, but I don't necessarily want to ever go through that again. I couldn't, I wouldn't be able to like to deal with I think the hardest part, like psychologically, was that the people that didn't care about like, masking or vaccinating or anything were the ones that kept like perpetuating the cycles at the time. And those were the ones that would like end up sickest in the ICU. And so there was basically, it felt like nobody was trying to end the pandemic, but we were so burnt out inpatient. So I think it taught me a lot. It was all worth it.
Yeah, I can definitely agree. COVID was a totally different time, and I just can't believe it's been 6 years since COVID. It's been such a long time.
I was like intubating people in the elevator, like
hmm
them in healthy, and then like couldn't even get them up to the ICU before they were like coding. So
Right.
I've just never seen anything where the patient can walk in the door on room air and then be like dying in front of you. Um,
hmm
so you learn to think on your feet quickly. I'm always grateful for those experiences. I don't mean to like complain about them. I just mean it. There's always a good story on how you got to where you are.
Yeah. So, what led you to start your own cosmetic practice, and what were some of the challenges you faced in the beginning?
Sure. So I would say like so I got to the point where I was going to resign from the hospital regardless, and I was pretty sure that I was going to open my own thing. In the transition period, I had started sort of like a mobile weight loss clinic where I was like working on the structure of it, like with my attorney and stuff, but just to make sure like how I could do it. And we did like telehealth appointments and went through, a pharmacy and stuff. Ended up getting like a good bit of clientele through in the couple months that while I was actually building the idea for like the full practice. But I basically said to myself, like, I have done this like misery thing for so long that I'm finally just gonna go for it, and we'll see what happens. But it was planned really well, and I think that so I guess the biggest thing is getting going. I did not have any funding. I did not have any savings. I had been just out of residency and stuff. So deciding how you're gonna do that is a big, like, you have to be, if you're gonna do it on cash flow, you have to be really successful right out of the gate. I think that it is hard to establish yourself as a new young provider in aesthetics, like in a city that has a lot of that, as somebody who does not have a fellowship training in, dermatology or plastics, or the more classic ones. And so that was something that, again, I used to feel self-conscious about, but I find it makes me so happy when I hear from my patients like that's actually the part that they enjoy the most, is like knowing that I know how to take care of them when, something bad happens. And not that it ever would, but somebody, they always say like, oh, you're a real doctor. So, yeah, I would say like some of like the stigma is the funding is always, always going to be a challenge in any business. I would say like deciding like the ways that you, as a solo entrepreneur who has no formal business education, the ways that you like where you focus your money first, because cash flow can be very like it's an art. So you have to decide like what, how much product am I buying, how much devices and employees and what's the rate of return on all that. And so there becomes a lot of like, more formal business stuff that is also something you need to learn really quickly. And then pivoting, like as you go, you're going to find things that work and don't work. And the best entrepreneurs and physicians are always going to find a way to fix what doesn't work because, the motivated people that succeed in this type of thing are always going to be making themselves better and their business better. And ultimately, it's about our patients, and I want them to get the best. So,
That's so beautiful to hear. And how did your educational background and training prep you to for both the medical and aesthetic side of your practice?
sure. Yes, I think that the medical side, like when you go to medical school anywhere, you have a significant, like a really intense and like anatomic anatomy focus. So I know for my medical school, LSU in New Orleans, we had 4 hours, so 8 to noon, Monday through Friday, like every day for the first 6 months of medical school. We dissected full bodies together. Like, I mean, we know the heck out of anatomy and the as a physician in it as opposed to like a mid-level or somebody with a different type of educational training which that's not a bad thing. Everybody has their roles in medicine, but we always had like the ethical focus. So the sales part of like owning a business is very foreign to me and like uncomfortable and stuff. So I think that the best thing I can say is like I had the like ethics to say to somebody, to a patient, where somebody in the industry might say, oh, I'm going to try to just sell them whatever I can. I know what is appropriate for me to treat, not treat, refer, just to counsel the patients well and put their needs first as opposed to like selling. And then also like I started injecting in medical school in dermatology clinic, like learning all of that stuff. So it's been like more than a decade that I've been injecting. And when I got my full medical license and started working, I started this little like side business doing concierge cosmetics, like Botox parties, and built up a little clientele from that too. So I would get like a lot more advanced trainings and opportunities through that. Like the more product we bought. So I had a really consistent and like even, I mean, really impressive actually, like people that I trained with all over the country and the world for injections, for laser, and really threw myself into like continuing that because it's genuinely just what I loved. But I've always had like when people ask me, oh, how do you like transition to aesthetics? That would depend on how much you've already studied it if you're an internist, because you can't just go for it for like a cush life. That's not what it's about. It's about loving skin. So I had a 10 years head start on studying skin. And then I think the other thing it's really cool with is I can really conceptually think about lasers very differently than dermoplastics because I understand kind of like the like medicine they call hospitalists like mental masturbation. We love to think about every side of things. We love to think about like the just overthinking. And so lasers are super complex, and coming up with your own complex protocols and ideas of how to use things innovatively is one of the things that really made my practice took off. So or take off. So I think there's multiple areas, but basically I had started a while ago and I kept up with that training and was able to really just refine it even more.
I love how your training and your educational background kind of shaped you to become the person that you are today and eventually opening up your own practice. So congratulations.
Thank you so much. Yeah, I think everybody needs to understand that like no matter what you want to do with your life, you're always going to face challenges in the universe. I mean, I think my mom told me this first, but like the universe gives you or doesn't give you what you want until it knows you're ready to receive it. So you have to like become that person that is ready to do the thing you asked for.
Definitely. So, can you share a typical day in your practice and what part of your work brings the most joy to you?
Okay, so the most joy to me easily is seeing my patients' reactions when they see their like what they got done in the mirror. I just like I love seeing them happy. I love that I get to be like that person that gives them like the confidence or whatever it is that they've been looking for. So that's hands down doing good work. A day in the life is so I'm typically open For now, Monday through Thursday, 12 to 6. So I'm a night owl. I won't like come in early, but I'll stay as late as people need. We have events often on weekends, but I'm going to be getting like a weekend injector too. I have a PA starting. And then I have my esthetician who does facials and peels and some of the laser stuff upstairs, spa services like Tuesday through Saturday. So I would say a typical day would be probably it's a combination of it's lasers like Potenza and Ultra. It's injectables, Botox and filler, and then new consultations. So I would say on any given day that each of those might be 30, 30% each, or sometimes it's a predominance of lasers. It just depends. But I specifically really only do like three very niche things, which is the lasers, the injectables, and then well, I guess the two different lasers, injectables. And then my nurse, Claire, runs the weight loss clinic. So we have a lot of different pieces going on, but we are busy and we are happy about it and we love it. So it's typically bim 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 all day long. And we're very happy about it. We've worked really hard to grow to this point. So yeah, it's good to be booked and busy. And we have a lot of fun here. Our patients kind of find the vibe, I guess through socials, but they found the vibe that kind of we are, and we realized like oh, everybody's so cool here, and then we are like, oh yeah, I guess we kind of put that vibe out on social media, so it's nice. We really enjoy it.
That's so amazing to hear, and I'm glad that your patients have like that nice well-being place, especially in your clinic as well. And I know a lot of people see aesthetics just as cosmetic work, but could you explain it a little bit more about why it's just more than that, and then how it can even affect people's confidence and well-being?
100%. So I will start actually with like my own journey with this. So I always loved like the science of skin and would study it, but really I had over the many years in like stress, like low sleep, like terrible food in the hospital, I had gained a ton of weight and I was like I was in desperate need of like something because I just couldn't do it on my own. And so I started the like tirzepatide. I lost 85 pounds. I like felt so much better about myself. Kind of starting my own journey with that sort of thing was really empowering, and I could also use my experience personally and professionally to help my patients do that. And then I think that the primary goal of aesthetics is not like for me to give everybody a frozen forehead or like advocate that every face needs to look perfect. I'm not sitting here shaming anything, wrinkles, acne, anything. What I want to do is make you feel the best about yourself. And like when you see the patient look in the mirror at like whatever pain point it was and see the like light in their eyes and the way that you can already tell that they feel like they're more empowered and more confident, that is intrinsically just like rewarding. It lights me up inside. So the way that somebody feels on the outside drastically affects, or I'm sorry, yeah, drastically affects the way that they feel like they can navigate life and situations. And even a little bit more confidence can help, but like a lot more confidence over time, which is kind of my practice model. We have a lot of like, people in monthly on memberships and stuff, and they really do like trust that. But when we realize how far they've come in 3 and 6 months, and they're so happy. Like I've had a guy call me at like 7:30 in the morning on a weekend that was like, this is the best thing to happen to me since the birth of my children. Like he was almost 70. And it was people are really, 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 really grateful in aesthetics. It's I would say like having done critical care for so long, I did objectively life-saving work all the time, and I never received a fraction of the sincere gratitude that I did then as I do in aesthetics. So you really do make a big quality of life and impact in what people care about the most. And then there's a lot of there's a lot of nuances that are like definitely not just like bimbo Barbie or whatever. Like anatomy is no joke. You have to know every anatomy, every variant, how to troubleshoot all of that. You got to know the heck out of like all your math for Botox and stuff. And we make a lot of that look easy, but none of aesthetics is easy or the like. I mean, we say we're like just a girl or whatever, give that vibe, but yeah, aesthetics is no joke, and the amount of people that do have complications from it or like botched or whatever will tell you that too. So So yeah, we work really hard to be a comprehensive clinic that focuses on what each individual patient wants. It's not what I want. It's not what Juju wants. It's what they want, and we deliver results.
I love that. So I know we talked a lot about your practice and your work, but are there any hobbies or activities that you do outside of work that helps you stay balanced and energized while practicing in your practice?
When patients ask me that, I always joke that my hobbies are golf and filler, golf and lip filler, but I'm like not even that joking when I say that. But no, I love to golf. I was always an athlete. I love to spend time with like my family, friends, my boyfriend. I have two dogs, two obnoxious poodles. Um, let's see, I love going like on an occasional trip when I can, although I haven't had like too much time to do that. I live in New Orleans, so there's always like, a festival or something when I can get out and do that. Um, what else? I enjoy Hi. So I really just like I can get down with a good time with good people anywhere. So I can sometimes just get it in New Orleans, there's always something a new person to meet or a new festival or something going on. So having come from small town PA, that was one of the things that really drew me to this too. So I'm pretty open to a good time as long as it's good people.
That's amazing to hear, and I'm so glad to hear about all those little hobbies. Was there was there someone or something that motivates you to pursue your dream of running your own practice?
Um, yes, there were a number of factors. I would say it was the decision to so when I resigned from my like stable hospital job with benefits and all of that, it was because I was so miserable that the the fear of failing like in going for it was worse, or it was nothing compared to the fear of being that unhappy. So you have like it was such a like level up in terms of what do I want in life, and so I just said to myself, I'm going to be miserable if I don't do this, and I'm going to go for it. So it was really just me making the decision I should have made all along.
I love that. And to wrap things up, what advice would you give to anyone who's trying to follow a non-traditional path in healthcare or combine multiple passions like medicine and aesthetics?
Love this question because more people can do it than they think. And when they ask me about it, it's always like very open-ended. So I feel like I need time to like really give them a good answer based on them. But for me, I would say you can do anything you want to do in life. If you are passionate about something, you're going to and it's a competitive thing, you're going to get told no like so many times. And it doesn't mean no, it means try harder and keep going. So if you're told no, don't you have to keep going. I would say it depends on the level of experience, if any, that you have in anything within aesthetics, and try to get your foot in the door with anybody who will even let you free shadow. Like people, I generally am very open to like people who want to learn. I love teaching people who want to learn. So show up, like don't be the one to be like, oh, I can only come for an hour and flake. Like go whenever. If you have a good opportunity with a good injector or laser person, like go to every one of those things because that's what matters for the recommendation you may or may not get. I would say build relationships with people in the industry, whether that's on like Instagram, making sure you're being like a positive, healthy community member, supporting the other providers in that space, and making sure that if you become known anywhere in the online space or locally, that you have demonstrated your interest and you're known for being like a hard worker and competent and whatever. So when I hire, I actually do not. I've never looked at a resume. Like that's not what I look for. So I can tell if somebody's motivated or how much they want to be there based on what I see. So just make sure you always show your effort. We can teach you your skill set, but we can't teach you like character or work ethic. So put yourself out there. You're gonna fail a lot. You're gonna make sure like I mean, you got to make sure you keep trying because you're going to be told no so many times, and people are going to be nasty to you, and you have to get over that too. You just got to keep persevering. And I would say study as many things as you can that are reliable. Like I'm an advanced injector. I train people. I still do trainings. Do as many as you can. See as many approaches of everything as you can. Do every training that you're offered. Y'all there?
Uh, Camden, are you able to unmute?
Oh, yes, so sorry. I thought you were asking the last question, but then I just remembered that you already did. Sorry about that.
Did
And
I say it appropriately for you? I didn't know if I missed something, part of the question. Like transitioning from another field.
oh no, you're all good.
Oh, the other thing that's important too is what state you're in, and you have to look up your state's requirements for what your degree is. So, like for Louisiana, I can inject as a MD, I can do like, whatever. My PA has my PA and NP like unlimited injection ability for mid levels, but nurses in Louisiana can only do toxin, not filler. My esthetician can use the lasers, so make sure you understand if what role that you are in and what your state's requirements are for that role and if you need additional education.
That is some great advice right there, Dr. Kimball. And thank you so much for telling us about your inspirations that reached you to this point in your career and
Thank
along with the things that you believe in.
Thank you so much. If y'all have any questions, feel free to give them my like email or DMs or whatever, and hopefully it was helpful to somebody who needs the motivation. But I'm always happy to help.
Absolutely. We'll put that in the bio as well. It was truly inspiring to hear about how you've built your own practice and created a space that empowers your patients.
Thank you. I appreciate it. Thank you.
And to everyone tuning in, thank you so much for joining us on today's episode of Vitals and Voices. Your engagement and loyalty mean so much to us.
If you
I will
enjoyed this,
I'll make sure to yeah to share it and everything. And thank y'all so much for having me. I really appreciate it.
of
Of
course,
course.
if you enjoy this conversation, then be sure to follow, share, and stay tuned for more episodes on Violets and Voices.
For sure.
We'll
Bye,
see
y'all.
you
Thank
next
you.
time.
Bye.
Bye.